As Ontario's hospitals are at overcapacity and struggle with the onslaught of the seriously ill COVID patients, Albertans are deeply concerned that their healthcare system may be headed towards the same fate. For several weeks now, Alberta has had by far the highest per capita infection rates in Canada. On Thursday, the province shattered its previous one-day record for new cases with more than 2,048 new infections. Also on Thursday, Premier Jason Kenney announced new, stricter public health measures to try to deal with the surge in cases. But some Albertans are wondering if the measures will be enough. Joining me now is Dr. Jia Hu. He is a public health physician in Calgary. Dr. Hu, first of all, thanks for taking the time.
Thanks for having me.
I guess I have to start. We see figures here, we see statistics, but I'd ask you what you make of those statistics that you're seeing now. How bad is the situation?
Yeah, I mean, I think they're obviously pretty bad. We did sort of see our one-day case, a new case count reach a record high. I mean, I think that, I do sort of we do follow what's happening in Ontario quite closely. And, I think that, what really can hurt the healthcare systems when the ICUs get overloaded. And, I don't think we're as bad as Ontario is yet, but ICU cases are sort of a lagging indicator that takes about 4 weeks to sort of show itself after a certain case count. And, it is very concerning. And so measures, I guess, were in place to try to respond to that very recently.
I was going to ask that because, I host a lot of press conferences from public health officials, and I've been watching the statistics in Alberta, and I think we've all been asking ourselves in Ontario, when we see per capita so much higher than in Ontario, how long that lag time is. Is there any doubt in your mind that intensive care admissions and even the number of people on ventilators is going to go up precipitously with the kind of rates you've been seeing?
Yeah, I mean, I think they'll definitely go up. I mean, really, it's sort of, you see the ICU numbers and the hospital admissions go up, let's say 2 to 4 weeks after a particular sort of, after the cases go up. Mm-hmm. In terms of how precipitously, I mean, I do think that many times during the pandemic, Alberta's actually had the highest per capita case count. Our numbers are not much higher than they were in our sort of second wave peak where we hit 1,900 new cases a day. And so because of that, I think, the health system, government is taking some action. I do think one of the advantages Alberta has versus Ontario is sort of the unified health system via Alberta Health Services can probably cope with a few more ICU cases. I mean, it's a lot easier to sort of move patients around, and there's a bit more coordination when you have a single health system, and that'll be at least something that we have to our advantage.
Okay. Jason Kenney mentioned, and we were watching last night, announced new measures and targeting certain hardest hit cities. He's targeted, there's sort of a cutoff point, but he's targeted certain cities. I mean, I'm going down the list: Calgary, Edmonton, obviously Wood Buffalo Regional Municipality, which is Fort McMurray in the area, Lethbridge, Grand Prairie. But they're just certain cities. It's not a blanket across the board shutdown, lockdown, and increased measures. Is that going to be enough?
Yeah, I mean, I think that given that this is the first time we're introducing higher level measures, I think it's a good approach, right? I mean, I think across Ontario, there were also at various points different type of hotspot measures, gray zones in the GTA, for example. Yeah. And, one thing that's always sort of hard to predict is human behavior. At the end of the day, most transmission is still driven by what I call private indoor social gatherings, and those have not been allowed for many, many months. And, with these new measures, I think we attempt to sort of signal to people that, hey, it is pretty bad. We don't want to get to a place where RSUs are truly overloaded and people who need care can't get it. It's hard to say what will happen in the future. I will say, after our second wave, when, the first sort of set of lockdowns, or in the midst of our second wave, after the first sort of lockdowns were implemented, our case counts fell quite quickly after that. Surprisingly so, actually. And, one can hope that happens this time. But I think, what was done was sort of a good step, frankly. And I do think a regional approach tends to be a good one, especially if there's a lot of variation in cases, depending on where you are.
It's interesting. So could, in a way, ironically, I mean, Premier Kenney has been having problems largely with his rural caucus in terms of measures that have been announced. He's had a lot of political pushback from his fellow politicians and his MLAs. But you're also saying that there's an advantage in adopting what many provinces have adopted, and that is a regional, agile, supple approach to different regions.
Yeah, no, absolutely. I mean, and I think there's certainly political reasons to do that, but there's also general adherence reasons, right? I think right now we see pandemic fatigue setting in across the entire country, right? And what you want to do is sort of have, well, insofar as they're effective, targeted interventions that are more, we'll say, severe, where there's really, really high case counts. Otherwise, if you're in places with few cases and, you're asked to go into aggressive lockdowns, people say, like, why should I even do this? And we're seeing plenty of that. We've seen plenty of that all over the country because people are pretty tired 15 months into this thing.
Okay, last question. I know you've just expressed your loathe to predict the future, so I'll ask you a different question then, and that is, when we look at Alberta, I mean, it's no secret, it seems to be the jurisdiction with the most ardent and common non-compliance. I mean, people just out and out rejecting public health measures. Last night, Premier Kenney again said, I'm not going to go further because if I go further, we run the real risk of people not obeying regulations.
Yeah, so is the question
what's it like to be in a jurisdiction like that as a public health official?
Yeah, I mean, I think that, well, there are maybe a higher proportion of extreme sort of super spreader type behaviors here. It's a problem that, we've seen all over the country, right? And, at the end of the day, I think that, all we can do is sort of implore the public to try to, sort of abide by the rules. I think information about sort of hospital and ICU overload, things like that can sort of change the needle. The further restrictions will hopefully change the needle as well. Right now, we just need people to, certainly limit their social interactions, right? Don't meet people indoors at all and get vaccinated as quickly as possible. I think that on a maybe optimistic note, if we look to the United States and how they're faring, I mean, their cases have totally collapsed. And, they're a couple months ahead of us in terms of the vaccination rollout. But I think, Ontario is emerging, which means, what they did during the third wave worked pretty well, worked well enough, I should say. At least the cases are going down, and I hope the same will happen for Alberta. Okay.
Well, on that note, on a hopeful note, I want to thank you very much for speaking with us.
You're welcome.